Doing your self-test. If you choose to do a self-test, you'll be given a test kit with detailed instructions on what to do. If you have any questions or difficulty with the test, ask your healthcare provider for help. Make sure your details are correct on the label and form and add anything that may be missing. You may need to fill in some information, like the date you do the test. What if I make a mistake? It is very easy to take your own sample, and this is just as accurate as one taken by a healthcare provider. It's very unlikely you will get anything wrong. It is okay to continue with the test if you have touched the swab tip with your fingers, though it's best to avoid this. Have inserted the swab into your vagina, but are unsure if you've inserted it far enough. If you drop your swab, let your healthcare provider know and ask them for a replacement. The self-test option will be suitable for most people, but talk to your healthcare provider to decide what's best for you. If you decide to have a self-test, these are the steps to take your sample. Step 1. Wash your hands with soap and water and dry them thoroughly. Step 2. In a private space, find a comfortable position to take your sample. You may like to sit, stand, lie down or squat. If you cannot find a position that works for you, ask your healthcare provider for help. Step 3. Take the tube containing the swab out of the bag and remove the swab stick. You may need to hold and twist the cap to break the paper seal. Try not to touch the swab tip either with your fingers or against any surface. Step 4. Holding the swab stick halfway down, use your free hand to open your vagina and gently insert the tip of the swab about 4 to 5 centimeters, about the length of your thumb, similar to inserting a tampon. Most people find it easy and comfortable to do. If you experience any pain, then draw the swab back a bit until it's more comfortable, or ask your healthcare provider to assist. Step 5. Rotate the swab about 4 times, around 20 seconds. Gently touching the sides of the vagina, then remove. Step 6. Once you have collected your sample, check the kit instructions for next steps on what to do with the swab. Make sure the cap on your sample is put on tightly so it is well sealed. Step 7. Dispose of any leftover materials in the rubbish bin, then wash your hands with soap and water and dry them thoroughly. Step 8. Place the completed sample and form back into the bag. Seal it and give it back to your healthcare provider. Your results will be sent to your screening provider in 1 to 2 weeks. They will let you know when and how you will receive your results and if any further follow-up is needed.